Hi, my name is Dr. Arthur Trotzky. I'd like to welcome you to my online therapy and group support website. You know, anyone can open a website by just getting the technology, making a web page, and presenting themselves as a psychiatrist, psychologist, social worker, counselor, or even a coach. It's very important if you're interested in the online therapy network to make sure that the person you're working with who runs that website is licensed and is in fact a professional. Now, if you'd like to find out more about me, you can please click on the Dr. Trotzky button above you. It will tell you about my career. And if you'd like to see what I've been reading and writing and publishing about, please click on the publications button above also. I've always been interested in new developments in psychotherapy and have followed various trends over the years. And I've also been interested in technological advances in our world. In the 1970s, when I was in Oregon, I was working with video. The new video technology came out. I don't know if you remember the big 3/4-inch cassettes that came out. They then became half-inch and smaller cassettes, CDs, and now they're all digital. This is all digital recording. I was working with video in the 70s. I developed a video-based counselor training simulation, which was used by several training programs in the United States universities. And I also worked training counselors and therapists, improving their skills using video feedback. Now, today, many of my colleagues are skeptical about the use of video for online counseling. Well, I can understand them. Some of them just aren't comfortable with new technologies. I remember when the fax machine came out. I was in New York. I had to send a fax to Boston. I went to a business center because I didn't have a fax, gave the man my resume. He put it through this very strange machine called the fax. And I remember how it went in. It went in here with that noise, tick, 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 came out the other side. 3 minutes later, it was in the hands of the employer in Boston, which would have, a process like that would have taken 2 or 3 days by post. By the way, the fax is now becoming more and more obsolete as new technologies are developed. I remember when I first got a cell phone or an iPod or a digital camera, or even getting a computer program off the internet. It seems overwhelming. I was so overwhelmed when I got my iPod that I actually went out and bought this book. Within 2 or 3 days, I was very comfortable with the new technology. Now, the same with this. I did a group session online here. I had 8 people, little boxes of 8 people, could see and hear them clearly, on the internet. At first, it felt very unusual. And I worried and got anxious, but within a matter of 5 or 10 minutes, I actually felt as if I were doing a group in my office. It was very, very natural. So we need to get used to the technology. Young people, however, those that were born in the last 20 years, are very comfortable with the technology because they grew up with cell phones, cameras in their cell phones, GPS in their cars. They're chatting on Facebook. They're Twittering. They're using ICQ. They're using Instant Messenger. And now they're using Skype with video capabilities. They call this social networking. And for them, the internet is part of their generation. I don't want to discuss the pros or cons here because we could go on and on with that. I think what I will tell you is that this is the future. I have no doubt. This will be the future. And it's starting now. I've just completed a course entitled Distance Counseling. It was put on by the Ready Minds Corporation and the Online Therapy Institute. Now, why, you may ask, do you need a credential in distance counseling? What is distance counseling? Well, it needs to assure that professionals, licensed professionals, using this technology, know how to assure that the same guidelines we use to protect confidentiality and the safety of our patients are brought from the face-to-face situation into this new medium, the online counseling network. And that's what this course will do. I don't know if you remember seeing the program or the movie Ordinary People. There was a young fellow who needed immediate crisis intervention from his psychiatrist. At that point, the psychiatrist said, "I'll meet you in my office in 40 minutes. Well, we need to assure the same technology for our online network, and this allows for immediate intervention. If you were to call me We go online, we meet in my virtual office, so to speak. Now, we also need to know that secure communications are available. I'm employing the latest encryption technology to make sure that any broadcast, audio and visual that goes out from me is scrambled or encrypted. When you receive it, it's unscrambled. Same thing when you speak into the microphone and you're photographed on the video. It is scrambled, and this assures complete confidentiality. I must tell you that all what I'm doing on the internet is in line with the guidelines for internet counseling set up and will be set up by the American Psychological Association and the American Counseling Association. So the same type of procedures that I use in face-to-face counseling are being transferred to the internet environment. I'm employing high-density audio and video transmission to ensure clarity. Now, the video you're seeing today is not high density. It is on the inside of this web page on the meeting room. Now, online counseling offers a tremendous savings in time and money. You don't have to travel downtown to your therapist's office. Many times people will call me. They're late for their session. They're stuck in traffic. There's been an accident on the interstate. So this enables you in your home environment or your office environment to have a session without leaving your environment, without getting into your car. A lot of savings in gas and money involved there. Now in the evening, you may decide, I'm not suggesting this as an alternative for your support meetings, but you may decide 11 o'clock at night, I'd like to go to a meeting. I don't feel like going out. It's raining, it's snowing, it's cold. I don't want to get dressed, and I just want to go to a meeting, or I'm having some cravings or some sort of difficulty. All you have to do, sign in, log in, and you're in your meeting. So there's some real big advantages for that. In addition, I don't need to rent or purchase an office where I have a waiting room, my individual office, the group therapy room, the bathroom, the kitchen. I mean, your refrigerator is within a couple of feet away from where you're sitting now, and I'm sure what's in your refrigerator is more to your liking than what I have in my refrigerator. So that's another major advantage of online therapy. Now, many of you may find it useful. You will need earphones and a microphone like the ones I'm wearing. These are not my ears. These are my ears. You can get thinner ones. I'm hoping these heavy earphones will make my ears go closer to my head. But all you have to do is go to Radio Shack or Best Buy or any technological store, electronics store, and purchase this. This eliminates any feedback, assures lip synchronization, and very clear communication, and you can hear real well. So if you'd like to arrange for an individual session or to try out a group meeting, please email me below or call me. We can tell you how to get started. Any of my new people will have to fill out the questionnaire on the website. You'll see it says questionnaire. Please click that and fill that out. And please read and check the informed consent on the home page. And you're ready to get started if you have the equipment. So I would also suggest one other thing. You do not use the Wi-Fi. I'm improving as I get into the technology. The Wi-Fi or the wireless connection, we've had some lip sync problems, and also it's more secure to be on a direct line. So you eliminate a lot of difficulties with the communications. If you're ready to start, just click on the email, as I say, and give me a call. We can give you an opportunity to try out this new technology. Well, I look forward to hearing from you, and those of you who have questions, I'll be happy to answer any of your questions. I'd like to thank you for visiting the website today and for your time. Thank you.